In this lecture, I'm going to be talking about the Hippocratic Oath, which, as you likely know, comes from, at least it's believed to have come down to us from Hippocrates, that I spoke about in the other lecture, who's considered to be one of the founders of Western medicine. And just before we look at the actual oath, which is still taken by medical doctors and versions of it, and we're going to be looking at a revised version of it as well. The whole idea of an oath is very interesting, and it links us back to the idea that I mentioned when we talked about shamanism, that as far back as we can trace in human history, the idea of someone as a healer tends to link them to, if not a religious or spiritual plane, to kind of higher law. And this is related to the idea that there are certain occupations that really move us beyond simply a job or a career, and especially those that are responsible for others. And in the case of a medical doctor, it's very obvious they sometimes are literally responsible for the life of another human being. So that's an incredibly serious responsibility, and so oaths are taken for jobs where there is that sense of public responsibility. This whole idea of oath taking is a very ancient practice, and you probably are familiar with the idea that of going into court and putting your hand on a holy book to ensure that you're going to be honest in the court. So the Hippocratic Oath is taken by people, not all of them, obviously, in the medical profession. And so we know, even in occupations like engineering, many of you will know that many engineers wear a ring on their pinky finger. It's made of iron. And there's a myth, I don't know, I don't think it's probably the case, but it doesn't matter. It's symbolic that the ring is made of the metal from a bridge that fell down. And so the idea that the engineer is meant to constantly be reminded by that piece of jewelry of their responsibility to the well-being of the public. So this idea of the oath has a quasi-spiritual sense to it, even in the secular age. And so now we're going to turn to looking at the original version that comes from the Greek. I'll start out by reading the first part. I swear by Apollo, physician, and Asclepius, and Hygieia, and Panacea, and all the gods and goddesses, making them my witnesses, that I will fulfill, according to my ability and judgment, this oath and this covenant. Okay, so right out of the gate, we see that this oath is being taken to these divinities. So obviously, if somebody's a believer in these divinities, as Hippocrates was, as far as we know, that means it's a binding oath. And so there is a sense of if you don't follow it, there will be some kind of retribution. And you can see again the god Asclepius, Hygieia, his daughters Hygieia, Panacea, the other gods and goddesses. And this idea that it's a covenant. So covenant again is a very religious concept, that you make a contract, a sacred contract with the divine. And Judaism has this very strongly in its tradition as well, that there's a kind of a binding sacred contract between you and the divine. To hold him who has taught me this art as equal to my parents, and to live my life in partnership with him, and if he is in need of money, to give him a share of mine, and to regard his offspring as equal to my brothers in male lineage, and to teach them this art, if they desire to learn it, without fee and covenant, to give a share of precepts and oral instruction, and all the other learning to my sons, and to the sons of him who has instructed me, and to pupils who have signed the covenant and have taken an oath according to the medical law, but no one else. Okay, so clearly you can see the gendering here, that this in ancient Greece was passed down to men, often to their sons, and in the patrilineal line. And so also it's a guild. So and many professions still retain this structure. If we look at the Law Society of Canada and so on, it retains a kind of guild structure where there's laws and codes that bind them. Psychologists also have these kind of rules and regulations about the profession. And so this idea that there's kind of esoteric internal knowledge that's only shared with those people inside of the group. And so also, we find with this the idea of learning by from a preceptor. And again, this is remains very common in our contemporary world. Certainly in my profession, A huge part of learning teaching is being an assistant to somebody and watching them teach. And so in my experience, you learn by what they do well and you learn by what they don't do that well. And this is often the case. Okay, again, weigh in here, please, but with nursing as well, often you're shadowing people, you're watching them, you're kind of molding yourself on them, you're being mentored by those people. And this is very common across occupation, and it seems to me that it's probably one of, if not the best way that people learn, is by seeing an example. And the other idea is that that person embodies the ethical norms also, and behavior of, ideally, hopefully, of the profession that you then model yourself on. I will apply dietetic measures for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice. I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. In purity and holiness, I will guard my life and my art. Okay, so you can see that this will come into direct conflict with the contemporary world, where we see legal abortion and legal euthanasia in the Canadian case. However, this larger kind of view, you probably heard the idea that to do no harm, that's the overarching kind of motto of the medical profession. And so, so this springs from that it's not the role of the physician to ever do harm to another human being. Obviously, this is very contested, and I know I had an interview with a medical doctor very recently who's Muslim, and she doesn't participate in those activities. And so within the Canadian system, if somebody has religious views, they are permitted to not participate in either abortion or medically assisted dying. So, but we're going to see with the revised version of this oath, I'm pretty sure this has been taken out. And so again, that idea of keeping the patient from harm and injustice. So there's a kind of a larger overarching sense of that you're there to protect this person from harm. So there's definitely a moral imperative that's felt within this oath. And the idea of keeping my life in purity and holiness, and also that the doctor themselves is living this kind of exemplary life. Not use the knife, not even on sufferers from stone, but will withdraw in favor of such men as are engaged in this work. Whatever houses I may visit, I will come for the benefit of the sick, remaining free of all intentional injustice, of all mischief, and in particular, of sexual relations with both female and male persons, be they free or slaves. Okay, so this seems to be referring to what we would now call a surgeon, so that the physician isn't impinging on the sphere of this other form of practitioner. Now, this next one remains in place, and so many professions have this code of conduct that it's actually against the code, and you can lose your license to have a sexual relationship with a patient. So this remains, obviously was an issue thousands of years ago and remains one to this day, and every now and then it'll come into the public sphere and the media of where this has been breached, but this is certainly still part of the ethics of the profession. What I may see or hear in the course of the treatment, or even outside of the treatment in regard to the life of men, which on no account one must spread abroad, I will keep to myself, holding such things shameful to be spoken about. Okay, this is also completely relevant because the idea, and again, it's a quasi-priestly function that you're telling very intimate things to your doctor about your physical health, your mental health, and so on. And so it's very important for the patient to feel that their privacy is being protected, and that that doctor's not going to be talking about them just in a public forum. And so this remains part of the profession. There is a kind of counseling function that is often part of it, and we can talk about this. I think this is being lost in many cases, but certainly in the past, particularly the general practitioner would often have a quasi-counseling function where the person would talk about how they were feeling and what was going on in their life and so on. I'd be interested to know if that does still happen. And then it goes on, if I fulfill this oath and do not violate it, may it be granted to me to enjoy life and art, being honored with fame among all men for all time to come. If I transgress it and swear falsely, may the opposite of all this be my lot. Well, okay. So as I said with Galen, there is this idea of wanting fame, which I find really fascinating. So that there's a certain kind of strange ego in it, despite all of these other aspects. I think that's interesting. But of course, to get that fame, you have to act impeccably and with honor. And also that idea that if you go against the code, there will be a kind of it's implying a divine reaction to that. Okay. So you can see many of the aspects of this oath are still part and parcel of medical practice into the present. So we're going to turn now to looking at a revised one that's used at a number of medical schools in the United States, and we'll have a look at that. I swear to fulfill to the best of my ability and judgment this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. Okay, you can see obviously there's no swearing to the gods and goddesses in this one, but it's attaching the person still to a covenant, and the word covenant is filled with religious meaning. So they're not using the word contract. So I find that interesting. So this idea that there's some form of higher law that's the basis of this oath, and also bringing in scientific gains. But again, interestingly, the idea of recognizing that you're stepping in the footsteps of others, that you're building on the work of others. So there's a kind of humility in that. And gladly sharing knowledge, so that then once you've fulfilled your training, you then train others, which remains a really important part of the medical profession. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of over-treatment and therapeutic nihilism. Well, this one's very contemporary. So this is speaking to the situation we find ourselves in our society, where our technology is so advanced that we can often prolong life. And this is an ongoing issue of the idea of quality of life versus just prolonging it because you have the ability to prolong life. I think they're probably talking about that. Also, the idea of prescribing drugs unnecessarily, which I'm going to be talking about shortly. I remember there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. So this is interesting too, and I find this interesting that they have stated explicitly that medicine is an art as well as a science, and that there is a human element in healing. So it's not just about the drugs and the surgery, which often seems to be the way medicine is going, that it's just all about that. And also, I find this interesting, the idea of saying, I don't know, and having the humility to go to your colleagues and put the well-being of the patient above your own kind of ego here. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it is given to me to save a life, all thanks, but it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God. This is worded quite strangely in this quasi-ancient tone. Okay, so clearly this is taking on board practices like medically assisted dying here. Very obviously a bit nervous about it, that idea that you have this godlike power to decide life and death. That's pretty terrifying. And so emphasizing that humility. And we see also the idea of privacy again, and so that remains just as relevant as it was thousands of years ago. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being, whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. This is fascinating. So this idea of, and I think this again can tend to happen in contemporary medicine, where it all just becomes about the illness and not that that's a person. And so this is emphasizing the idea that you're treating a human being, and also you're treating a human being who lives within a family system or community system. And I think this is increasingly being part of training in medicine again. I will prevent disease wherever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those of sound mind and body, as well as the infirm. Okay, so this one is recognizing the idea of prevention, and rather than simply dealing with symptoms and trying to cure something that's already happening. And the idea that the doctor is a member of the larger society, and I'll be talking about this when we get to the section on Judaism. This is also very important, and I think it's underplayed, certainly in the Canadian case, that the doctor is answerable to their society and their community. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. That's lovely. So very similar to the actual original Hippocratic Oath here, this idea of if I maintain this covenant, things will go well with me, and I'll be remembered with respect and affection when I've passed on. Also, the idea that you're part of a long lineage and tradition, and you need to uphold that. And again, the idea of a calling. Okay, so that use of the word calling, that this is not just a job 9 to 5, and that you do just for payment. And I think that remains at the heart, not just obviously of medical doctors, but healers in general. Healing as a profession is often not 9 to 5, as anybody who's in them will know. People may have to work in the evenings or be called at home and so on. And so it requires a particular type of person who's willing to go above and beyond, and probably often won't have what other people call life-work balance. But the idea that this is a higher calling. I want to end by giving a concrete example of the Hippocratic Oath in practice. I have had the great pleasure of actually meeting Dr. Nancy Oliveri in person, and she ended up in one of the most famous cases related to research in the world. And so in the late 90s, she became involved in a struggle with the Hospital for Sick Children, the University of Toronto, and the pharmaceutical company Apotex regarding a drug. And so she was doing a clinical trial on the drug and to evaluate how effective it was. And during the course of the trial, Dr. Oliveri became concerned about evidence that pointed to the toxicity of the drug being studied. And so she wanted to immediately stop it and to warn the people in the study. She was immediately, there was an effort to silence her by the drug company and by the University of Toronto. And so this hit the papers. It was a huge, huge debacle for all concerned. And there is no doubt that Dr. Oliveri put her job on the line and her whole reputation on the line, in her view, to protect the community. And so she was informed by the Research Ethics Board that was monitoring the study that this was the right course of action. So Apotex responded by noting that Dr. Oliveri had signed a confidentiality agreement, and these things are so pernicious. And so the idea that it's sort of like she's beholden to the drug company rather than to health and well-being of other people. And so this is where we see the importance of something like the Hippocratic Oath to make very clear where your loyalties lie ultimately. And so Apotex threatened to vigorously pursue all legal remedies against her if she disclosed her conclusions to patients. So you can see she's put into this incredibly challenging position while her employer is not backing her up at all. Now, we need to back it up a little bit. In the 1990s in North America, we started to see a lot more research trials being funded by big pharmaceutical companies. And this is a very questionable model. Because obviously, if somebody's paying for it, they want a certain result. And so it turns out that Dr. Oliveri, and there was also a case in California of these whistleblowers, turned out to be a canary in the coal mine, pointing out the problem with this model of research. Previously, research had been funded by the government and by universities. So this showed very clearly a lot of the problems with this model. And so she was eventually vindicated, and she became an international sort of hero. And certainly I feel that way about her. I think she showed just incredible integrity and courage in facing down this very powerful company with all sorts of money at its disposal. So she was vindicated by the College of Physicians and Surgeons of Ontario in 2002. I was living in Toronto at the time, and I was watching in horror as she risked her job and reputation with seemingly almost no one defending her. Now, of course, she's been completely vindicated and is, as I said, recognized internationally. So I had the good fortune to meet Dr. Oliveri years later, and she was speaking to me about another physician who had become a politician, and she said she is putting her politics above her Hippocratic Oath. And so I was very struck that clearly Dr. Oliveri was acting from this idea of her higher calling as a doctor for the well-being of society and the healing of society, rather than any lower level loyalties such as politics or to your career. So this very much struck me, and this has had ongoing significance as these cases have become more and more common where drug companies are funding drug trials. And so I'm going to try to find an article, but there's been all sorts of controversies at various universities where there's much too close a relationship between the pharmaceutical companies and the schools of medicine. And so we've seen the incredibly tragic outgrowth of this in the overprescribing of OxyContin, and so it's very clear it's too much to ask of every individual doctor to have the integrity of somebody like Dr. Nancy Oliveri, but luckily for all of us, she had that kind of personal honesty and devotion to her calling, and so. I think this illustrates very clearly why these oaths need to be in place, particularly for professions that affect the life and well-being of our society.